Hey guys, Dr. Bakerink here. Today I just want to talk really briefly about an incident that I had with a patient not too long ago, and I decided it'd be important to impart that to you here. I had a baby that came in. Mother brought the baby in for a routine 2-week well check. Everything is fine with the baby, but when I listened to the baby's heart's going about 300 beats a minute. And this is like way too fast, right? For any of us, especially children. So this baby ended up in the intensive care unit. Everything was fine. The baby's done fine. Baby's on medication and everything is okay. The reason I wanted to talk about that was because in this day and age, we tend to jump onto the technology side of things pretty quickly. One of them is telehealth, and this is my concern with telehealth. I use telehealth a lot during the pandemic. I don't use it as much now, and this is the reason being is because I think that when you're treating patients, medicine is an art, not just a science, and so there's a lot to be said for actually laying hands on a patient, listening and seeing, and we can pick up a lot more this way. I can even pick up things with smell when I walk in a room. I know it sounds very interesting, but if a child sticks a bean up their nose or something like that and it starts to fester a bit, you can smell that. So none of this stuff can be done over telehealth. And so the reason I'm imparting that to you is that I think that there's a place for this technology, but it's very limited. So kind of just keep that in mind. Another good example of this is on telehealth, we oftentimes have to almost like over practice. What I mean by that is like if a parent says, oh, my child's pulling on their ear, and they just hold the child up to this camera, I don't know if this kid's got an ear infection. Most commonly, based on the age of the child, it's actually teething. So, but unfortunately, over telehealth, we often practice defensive medicine. So we're just like, oh, okay, well, let's give some antibiotics to the child at the off chance they have an ear infection. But this is not an appropriate way to treat patients. So just kind of keep that in mind. I think that there are some uses for telehealth for some very basic things. But by and large, I think it's important to actually lay hands on a patient, talk to a patient, talk to the parents, see what is going on with them. I think this is the best form of medicine. So it has its uses, but just kind of be aware of that. Thanks, guys. Take care.